When we're looking at the diagnostic criteria for alcoholism, we have to realize that going back in the 1970s, in establishing guidelines for diagnoses, the first step was taken when a publication of the criteria for the diagnosis of alcoholism was prepared by a committee with the National Council of Alcoholism, or NCA, and published in two major medical journals. What was identified were the signs and symptoms that could be ascertained through physical examination, medical history, social history, lab test, and clinical observation. Today we would kind of call that a biopsychosocial assessment in addition to the lab test and clinical observation. Many similarities between the symptoms of alcohol dependence developed by E.M. Jellinek in 1952 and the criteria 20 years later. A lot of similarities as well as confirmations of Jellinek's work. The interesting thing is that the NCA, the National Council on Alcoholism, criteria never had a significant impact on medicine as a whole, but became well known within the substance abuse industry. They clearly influenced the American Psychiatric Association and served as a model for changes in the following decade with the APA. Now, in regards to the DSM-3, for the first time, substance use disorders became a major diagnostic category. Now, keep in mind the current DSM-4 identifies alcohol dependence and alcohol abuse. The criteria are clearly defined. But as we soon develop the DSM-5, you're going to see a couple of changes, and we will no longer be distinguishing alcohol dependence and alcohol abuse as separate conditions. In fact, they will be combined to create a single condition called alcohol use disorder with two levels, moderate and severe.